Hi, Kevin Henry, the Group Editorial Director for Advanstar and Modern Hygienist, and I'm on a Google Hangout today with America's Dental Hygienist, Anastasia Turchetta. Hey, Anastasia, what's up?
Hey Kevin, doing great. How about you?
Rocking along on a Friday. Hey, just wanted to talk to you for a minute. It's been about 2 months or so since we did our last e-cigarettes video and talked about the effects of that. And a lot has changed in that time. And I really wanted to just kind of get your thoughts a little bit on kind of some of the updates that have come out since you and I did our last video.
Wow, I mean, you're right. First of all, we got great feedback from people on the e-cigs, and then we got some ones where it was questionable. So just to kind of reiterate in case anybody missed our first video, basically there's this three words, Kevin, that you and I love to hear, and sometimes we don't hear them, but we were right. We were right on the fact that, they're not regulated because right now the FDA is trying to regulate them. And that was one of the points that somebody had brought forward, and I appreciate the feedback and welcome it because it only keeps us at the top of our game in trying to keep up with the research. So bring that feedback to all the viewers. But the FDA is now trying to regulate them, and now 53 scientists in the World Health Organization are trying to pass some sort of a law, if you will, where the fact that e-cigs are not a tobacco product. That being said, it's really important for hygienists and dentists to understand, okay, yes, it's not literally a tobacco product, but you know what? It contains liquid nicotine, and liquid nicotine can be quite lethal. 1 tablespoon can kill an adult, 1 teaspoon can kill a child. What they didn't know a couple of months ago, which they're finding out now, is there's a lot of inflammation and people are having restriction in their airways, in breathing, in the pathway to the lungs. So that's something that we didn't see before, and I'm always an evidence-based person, and we don't have the evidence that they're so helpful to have smokers quit.
So, Anastasia, one of the things that a lot of people were talking about after our last video is that e-cigarettes really helped me transition away from smoking and, get off of cigarettes, which, if that worked for you, that's awesome. Great, congratulations on that. But you and I were looking at a study recently that's kind of showing that that's not the case for much of the general public, right?
Correct. Yeah. In fact, there was a study that was done, and we could provide the link if anybody wants that. 84 studies showed, I got to look at my notes, that there was no evidence that e-cigarettes helped regular smokers quit. I'm not saying there is not a small population, but this seems to be the big message. Oh, it's going to help everybody quit. When, in fact, guess where the target is at? Middle school to high school kids, because there's flavors. So the other thing with the regulation that I'm in favor of and we need to know in dentistry is, you know what, some of those are going to have nicotine in them, but they're not regulated in how much nicotine you get. In fact, some of them had, and it was on the same plant, get a load of this, 26.8%, and it ranged to 43.2%. Same company, same e-cig, it was just a difference in range of liquid nicotine. We just need to know the facts.
And I want to touch on something you just mentioned, how that a lot of the flavoring may really appeal to the middle school and the high schoolers, and that's something that as you as a dental hygienist and as a dental professional, you need to be watching out for and really talking about with your patients, right?
Right. I'm not seeing that this is going to be something that kids are going to do in front of their parents. However, I do think it is part of our taking a health history role. Most of the time it's not going to have e-cigarettes on there, yet when we do see these middle-aged kids, it is our responsibility to literally say, hey, you know what, I just read an article that middle school to high school kids are more targeted for e-cigs. Do you notice that going on in your class? I mean, something like that, I feel it opens the door. You know what, it's not judgmental, you just want to find out some information. You may be surprised what's going on in your area.
And so let's talk just for a minute. I mean, you as a working hygienist, how do you have this conversation with not even a middle schooler, high schooler, whatever, but just as a patient talking about the e-cigarettes? How do you open the door whenever you're ready to have that conversation?
Well, that's a great question, Kevin, because everybody really is different. So I know some of the people that as soon as you start to talk, they're the fact people. So that's when I would say, hey, have you seen this in the news? And especially if they were smokers or if they've wanted to quit. I will bring up some facts, whether it be studies or whether it be we have no evidence that this is helpful, or did you know that there's liquid nicotine in these, and start it that way. If it was somebody that's a parent or they themselves are in middle school to high school, I always like to bring in current events with what's happening in our oral health. And I think that's a great way to do it. And say, hey, have you seen the news recently? I'm surprised that they're targeting middle school to high school kids. And it may surprise me not having children. I wonder how big that is in our community. What do you think? You know, and kind of like ask their opinion and open the door, because people are interested. It's just our duty to open the door and then help educate them while we're doing that.
All right, well, let's just figure it out as far as how we talk. Because, like you said, so many patients are different. And,
Right.
and I think that hygienists and dental professionals as a whole need to, that's part of that patient relationship, is just knowing what that person, you know, what interests them, what's kind of their triggers to even talk.
Exactly, and it may come from a point, if they were a former smoker, to let them know this. I think it may come from a point, you could do it from a new standpoint. And then finally, too, you might take it from an, I don't know, you might share an experience, whether you yourself in the dental profession smoke or vaporize, you know, so you might want to start a conversation with that. The whole point is to let people know there still is no evidence that this is healthy for us over, you know, nicotine or not nicotine, the tobacco products. And I think that's the real concern. I think people look at it as it's a healthy alternative. We don't have the facts and the evidence out on that. When we're just getting it on the lungs, to me, there's going to be more down the road.
So let's sum up real quick. We want to make sure that we're talking to our patients about this. We want to make sure that we're getting this on our health history, you know, in our offices, and really that's going to open up some more conversation, right?
Correct. You know, just being open to it, we're the ones really to probably bring it forward to the patient. I really don't see a patient coming into the office and saying, hey, by the way, guess what I've done? I've started to vape.
Right.
I'm not seeing that happen. You know, so it is our responsibility to bring it forth. And how do you deliver it? Do you want to start it with the news, or do you want to start with the health history? That's really the place to go.
Anastasia, is always good stuff. I really appreciate the time, and certainly looking forward to hearing the feedback on this. So thanks so much.